Today we will discuss the surface marking of thorax. Okay. Surface marking comes of 5 or 10 marks in your practical. You have to pull out cards. In card there will be one point and one line you have to draw. Okay, you have to draw over cadaver or over some person. Okay. So for points you have to use white chalk dust. Okay, and for lines you have to draw. For arteries you have to take pink chalk dust. For vein you have to take blue chalk dust. For nerve there will be single line because nerve does not contain any lumen, so you have to take yellow colored chalk dust. Okay, all these 3 types of chalk dust will be available. 4 types: pink, blue, yellow and white. Okay, for point you have to use white chalk dust and you have to join these points to draw a line. Okay, for artery and vein there will be double line. For nerve it will be single line. Okay. Okay, so we will discuss important points. Okay, and at last I will tell you which cards are present in our department. So you practice those points. You remember carefully the points and lines. Okay, so you understand from here. So first is important landmark is xiphisternal joint. Okay. Okay, so these points and marks, these are important during your clinical examination of different parts of the patient. Okay, during percussion or auscultation, these points you have to remember. In your final year clinical examination of patient you have to do. So these surface marking points are important for those. So xiphisternal joint. Here is the xiphisternal joint, where body of the sternum and xiphoid process of the sternum is joining. So it is infrasternal or subcostal angle that marks the xiphisternal joint between the costal margins. Okay, these are the 2 costal margins. In between the costal margins, here lies the xiphisternal joint. Projects into the subcostal angle. Costal cartilages, second costal cartilage articulates at the manubriosternal joint, that is sternal angle here. Here is the sternal angle, junction between the manubrium sternum and body of the sternum. Here second costal cartilage is joining. That's how we count the costal cartilages and rib. At the manubriosternum, second costal cartilage and second rib. After that second intercostal space, then third rib, fourth rib, like this you count from above downward. Okay, understood? Next we go to sternum. Sternum lies subcutaneously in the midline. Here will be the sternum. It has 3 parts: manubrium, body and xiphoid sternum. Okay, you have learned during bones. Next is suprasternal notch, jugular or interclavicular notch, also known as jugular notch or interclavicular notch, lies between the clavicles just above superior border of the manubrium sternum. Here is the suprasternal notch. Trachea is palpable in this notch and level of this notch is lower border of T2 vertebra. Okay, second thoracic vertebra, lower border. Here we have learned at the sternal angle lies the lower border of T4. Okay, so this point is above suprasternal notch, is above the sternal angle, so it is lying at the level of T2, lower border of T2 vertebral level. Costal margins are formed by cartilages of 7th, 8th, 9th and 10th rib and free ends of 11th and 12th ribs. Okay, here this is the costal margin. It is formed by the joining of cartilage of 7th, 8th, 9th and 10th rib and free ends of 11th and 12th ribs. Spine of 7th cervical vertebra or vertebra prominens can be felt at the root of the neck. Here posteriorly, here will be the spine of 7th cervical vertebra. If you turn the head forward, this prominence you can feel at the back of the neck. After that vertebra prominens, These two spines are important. Spine of third thoracic vertebra, T3 vertebra, you can feel it at the level of root of the spine of the scapula. Okay, root of the spine of the scapula lies at T3 vertebral level, and spine of 7th cervical vertebra, 7th thoracic vertebra at the level of inferior angle of the scapula. Okay, so root of the spine T3 vertebral level, inferior angle of scapula T7 vertebral level. Next is nipple. Nipple in males located in 4th intercostal space at about 10 cm from the midsternal line, and in females position varies, position of the nipple varies. Okay. Next we go to the apex bit, also known as ictus cordis or apical impulse. What is apex bit? It is outward thrust of cardiac impulse felt at the, this is very important, very frequently given in your surface marking, apex bit. Okay, apex bit is very important. It is outer thrust of cardiac impulse felt at left 5th intercostal space just medial to the midclavicular line, that is 10 cm, midclavicular line is 10 cm lateral to the mid-sagittal plane. This is mid-sagittal plane. It is this mid-clavicular line is 10 cm away from this midline. Okay. So apex bit is lying outward thrust of cardiac impulse felt at 5th intercostal space just medial to the mid-clavicular line. Okay. Next, lines on the front of the body wall. First one is mid-sternal lines. Okay, this is the mid-sternal line, middle line of the sternum, and it passes through the mid-sagittal plane. Okay. Next is parasternal line, lies along the lateral edge of the sternum. This is parasternal line. Next is mid-clavicular line. It is imaginary line passing through the middle of the clavicle. This is mid-clavicular line. Where this line is passing, that is important, okay, for your viva, and for abdominal surface marking also these lines are important. Okay. Mid-clavicular line is imaginary line passing through the middle of the clavicle, tip of the 9th costal cartilage. Here at the costal margin it is crossing the tip of 9th costal cartilage, and mid-inguinal point here at the lower end it is crossing through mid-inguinal point. Mid-inguinal point is midpoint between the anterior superior iliac spine and the symphysis pubis. Okay. Next, lines on the lateral side. 3 lines are present here: anterior axillary line, posterior axillary line, and mid axillary line. Anterior axillary line here, this is anterior axillary line lying along the anterior axillary fold. This is posterior axillary line lying along the posterior axillary fold, and this is mid axillary line lying between these two. So anterior axillary line lies along the anterior axillary fold, posterior axillary line lies along the posterior axillary fold, and mid axillary line lies midway between the anterior and posterior axillary folds. Okay. Next we go to the lines of posterior side. These are scapular line, that is known as linea scapularis, vertical line passing through the inferior angle of the scapula. Okay. It has not shown in this picture. And mid-dorsal line is posterior median line, lies on the dorsal side in the mid-sagittal plane, midline. Okay, posterior aspect, midline is known as mid-dorsal line, and scapular line is vertical line passing through inferior angle of the scapula. Okay. Now we have to draw surface marking of the heart and its border. Its borders generally comes in your surface marking. Right border of, draw right border of the heart, draw left border of the heart, like this it comes, okay, in your surface marking cards. Okay, so heart has 4 borders. You have learned heart viscera. Okay, so heart has 4 borders: right, left, upper and lower borders, and can be drawn by joining these following points. 4 points you have to draw: A, B, C, D, E, 5 points. Okay. So first point at the lower border of second left costal cartilage about 1.25 centimeter lateral to the sternum, here point A. At the lower border of second left costal cartilage 1.25 centimeter lateral to the sternum. Next is point in the left fifth intercostal space just medial to the midclavicular line, here is point B. Left fifth intercostal space just medial to midclavicular line. Next is lower border of right sixth costal cartilage 2 cm from the sternal margin, here 2 cm from the sternal margin at the sixth costal cartilage. Next point in the right fourth intercostal space, here right fourth intercostal space about 4 cm lateral to the median plane, and point at the upper border of third right costal cartilage about 1 cm lateral to the right sternal margin. Here is the 1 cm lateral to the sternal margin. So for right border you have to draw these 3 points and join these 3 points with lines. C, D, E you have to draw and join these 3 points with lines to draw the right border of the heart. It comes in your surface marking card, okay, right border of the heart. And for drawing the left border, point A and B you have to join, okay, to draw the left border of the heart. These two are very frequently comes, right and left border. And this is inferior border B and C. If you join the B and C, this is inferior border, and A and E if you join, this is representing the superior border of the heart. Okay, understood? Okay, so left border join points A and B with convexity towards the left. This is left border. Inferior border join point B and C. Right border join point C, D, E and E. C, D and E convexity towards the right side. And superior border join points A and E. So these are the 4 borders of the heart. Next you have to draw surface marking for cardiac valves. 4 valves are there: mitral valve, tricuspid valve, aortic valve and pulmonary valves. These are the 4 valves of the heart. You have to know the auscultatory region of the heart and location of these valves. So heart valves produce sound on their closure, and these sounds are heard based using stethoscope in areas located slightly away from the valve in direction of blood flow. They are called auscultatory areas for these valves. Okay. So we will discuss individual valves, their location, that is surface marking of this valve, and auscultatory area. Auscultatory area of these 4 valves are important to hear any insufficiency or incompetency of these valves. Okay, there will be murmur in these locations. Normal heart sound will be absent or it is mixed with the murmurs. Okay. So first we discuss the mitral valve or bicuspid valve. This M represents the mitral valve, and this is the auscultatory area for the mitral valve. So mitral valve 3 cm long oblique line behind the left half of the sternum opposite the left fourth costal cartilage. Auscultatory area is the left fifth intercostal space just medial to the midclavicular line, that is over the apex bit. So this is the location of auscultatory area, fifth intercostal space just medial to the midclavicular line, apex bit. I have told you apex bit is very important. You will learn it in your physiology also. Okay. Next is tricuspid valve. See here the T is representing the tricuspid valve, and this is the auscultatory area for tricuspid valve. This is tricuspid valve is 4 cm long vertical line behind the right half of the sternum opposite 4th and 5th intercostal spaces, and auscultatory area is lower end of the sternum. Here is the location of auscultatory area of tricuspid valve. Okay, understood? Next we go to aortic and pulmonary valve. Aortic valve A is representing aortic valve, P is representing pulmonary valve. This is the auscultatory area in the right second intercostal space for aortic valve, and in left second intercostal space auscultatory area of pulmonary valve. Okay. So, aortic valve 2.5 cm long slightly oblique line behind the left half of the sternum opposite the left third intercostal space. This is the location of aortic valve here. And auscultatory area is in the second right intercostal space here near the sternum. And for pulmonary valve, 2.5 cm horizontal line, this is pulmonary valve, 2.5 cm horizontal line behind the medial end of left third costal cartilage and adjoining part of the sternum. And auscultatory area is second left intercostal space near the sternum here. Is the auscultatory area of pulmonary valve. Okay, understood? So, all the valves we have completed. These are important for your auscultation. In your final year also, it is important for you. Apex beat. Here is the point of apex beat. Palpation of apex of the beating heart can be felt in the left fifth intercostal space just medial to midclavicular line. See, this is midclavicular line in the left fifth intercostal space just medial to the midclavicular line. Approximately 9 cm lateral to the midline. All these points you have to tell in your viva during the surface marking. Next we go to the reflection of pleura, and after that we will go to reflection of the lung, okay, or surface marking of the pleura and surface marking of the lung. First we will discuss the pleura. See, this green line is representing the pleural reflection, okay. These are different for right and left side. Some points are common, but some points are different because of presence of the cardiac notch on the left side. So, two layers of pleura is present, visceral pleura and parietal pleura are separated by the pleural cavity. In living person, in living surface anatomy, parietal pleura shows these following reflections. There is apex, this is cervical pleura, anterior margin, inferior margin and posterior margin. Okay, reflections of the parietal pleura. So, cervical pleura also known as cupola. Here is the cervical pleura. What points you have to know? It is marked by curved line extending from sternoclavicular joint to the junction of, here is the sternoclavicular joint. You can see clavicle is joining with the sternum, clavicular notch of the sternum. So, first point is the sternoclavicular joint to the junction of medial 1/3 and middle 1/3 of the clavicle. Here is the junction of medial 1/3 and middle third of the clavicle. Extends about 2.5 cm, that is 1 inch above medial 1/3 of the clavicle. Here another point is 2.5 cm above this medial 1/3 of the clavicle. Okay. So, these 3 points you have to join with the curved line to draw this cervical pleura. Next we go to the anterior margin of the pleura. This is anterior margin of the pleura. It is also called costo-mediastinal line of pleural reflection. It can be marked by this is varies. For cervical pleura both lungs it is same, but for anterior reflection of pleura, two lines are different for right and left side. So, on the right side, see, this is on the right side, extends vertically downward from right sternoclavicular joint C, that is right sternoclavicular joint, this is point C, to the midpoint of the sternal angle. Here this is point D, midpoint of the sternal angle. Extends up to the midpoint of xiphisternal joint. Here is the midpoint of xiphisternal joint. So, these 3 points if you join, it represents the anterior margin of pleura for the right side. And on the left side, it extends downward from left sternoclavicular joint, here is left sternoclavicular joint, to midpoint of sternal angle, descend vertically up to the level of fourth costal cartilage Here is up to the level of 4th costal cartilage. Up to here it descends vertically. After that the reflection is present. Arches towards the left to reach the left margin of the sternum here. Further descends downward to reach the 6th costal cartilage. E1. Here is the 6th costal cartilage. Then this deviation due to the location of the heart or bare area of the heart. So these points you have to join: sternoclavicular joint, midpoint of sternal angle, level of 4th costal cartilage and 6th costal cartilage. These points you have to join to draw anterior margin of pleura on the left side. Okay, understood? Next we go to inferior margin of pleura, also called the costodiaphragmatic line of the pleural reflection. Here this whole thing is the inferior margin of the pleura. Can be marked as follows: on the right side extends laterally from the xiphisternal joint, crosses the 8th rib in the midclavicular line, crosses the 10th rib in the mid-axillary line and 12th rib in the paravertebral line along the lateral border of the erector spinae muscle. Here is the lateral border of erector spinae muscle. So all of these lines are joined, points are joined to draw the inferior margin of the pleura. This is also same for both the lungs, inferior margin of the pleura. On the right actually extends from this xiphisternal joint and on the left side it extends from this E1 point. Okay, that is small difference on right and left side. On the left extends laterally from the left 6th costal cartilage, that is E1, and follows the same course as on the right side from F to H. Okay. 8th rib in midclavicular line, 10th rib in mid-axillary line, 12th rib along the lateral border of the erector spinae muscle. Okay. Next we go to the posterior margin of the pleura. You can see this, we are viewing from the posterior aspect. You can see the spine of the vertebra. So this line is the posterior margin of the pleura, also called costovertebral line of reflection. Okay. Extend as vertical line 2 cm lateral to the spinous process. This is spinous process, 2 cm lateral to the spinous process. This line is extending vertically. Along this line, costovertebral extends from C7 vertebral level here. C7 means vertebral prominens, 7th cervical vertebra up to T12 vertebral level here, T12 vertebral level H. Okay. And along this line, costovertebral pleura continues with the mediastinal pleura. Okay, understood? Next, so we have completed reflection of pleura: anterior reflection, cervical reflection, inferior reflection and posterior reflection. Now we go to the surface marking of the lung. Okay. Apex of the lung coincides with the cervical pleura. Here you have seen drawing of the cervical pleura, 3 points at the sternoclavicular joint, junction between the middle and medial third of the clavicle and 2.5 cm above the medial 1/3 of the clavicle. So these 3 points you join to draw the cervical pleura. So this apex of the lung coincides with cervical pleura, can be represented by convex line joining these following points: junction of middle and medial 1/3 of clavicle, point 2.5 cm above the medial end of the clavicle and midpoint of sternoclavicular joint. These three we join to draw the apex of the lung. Okay, understood? Next, lower border of the lung, it crosses the point F at the 6th rib in the midclavicular line, G, that is 8th rib in the mid-axillary line here, GH. Okay. H is 10th rib in the paravertebral line, that is located posteriorly and 2 cm lateral to the 10th thoracic spine. So these are the points you have to draw for lower border of the lung. So here is the F, here is the G. and H is located posteriorly. Okay. Next we go to the posterior border of the lung. Here you can see the difference between the pleural reflection and lung reflection. The blue line is representing the pleura and the pink line is representing the reflection of the lung. Okay. So for posterior border of the lung from here to here extends from H, that is 10th rib in the paravertebral line, here 10th rib in the paravertebral line, I from H to I, here is the I, 7th cervical spine level in the paravertebral line. Okay, understood? These 2 points you have to draw and join with the line to represent the posterior border of the lung. Next we go to the fissures, oblique fissure and horizontal fissure. Oblique fissure can be marked by joining point J, that is point 2 cm lateral to the third thoracic spine. J is located posteriorly on our posterior one. Oblique fissure is completely cutting the lung into lobes. Okay, so one point is lying posteriorly. Then K is a point on the 5th rib in the mid-axillary line. Here is the K, point of K, point on the 5th rib in mid-axillary line. And L, here is L, 6th costal cartilage, 7.5 cm lateral to the median plane. Okay, so these 3 points you join to draw the oblique fissure of the lung. Next we go to horizontal fissure, present only in the right lung. Here is the horizontal fissure, can be marked by horizontal line along the 4th costal cartilage. Okay, horizontal, here is the 4th costal cartilage. Line extends from anterior border, that is 4th costal cartilage level, to the oblique fissure at the 5th rib in the mid-axillary line. This was we have drawn for oblique fissure. So from here 4th costal cartilage to point K in the 5th rib in mid-axillary line. These two you join to get the horizontal fissure. Next is trachea. Trachea is also very frequently given in your surface marking card. How you draw it? Marked by 2 parallel lines. Trachea also have a lumen, so we draw 2 lines. But here white chalk dust you use. Okay. So trachea marked by 2 parallel lines 2 cm apart from lower border of cricoid cartilage to manubriosternal angle. Here is the thyroid cartilage. After that, this one is cricoid cartilage. So lower border of cricoid cartilage to the manubriosternal joint here. Here this is sternal angle, manubriosternal joint is sternal angle. Here the trachea bifurcates, we have known. So from here to here, you mark by 2 parallel lines 2 cm apart. Slightly inclined to the right, that you know trachea is slightly inclined to the right side. Next, 2 principal bronchi, right and left principal bronchi. Right principal bronchi runs from lower end of trachea, here from lower end of trachea downward and to the right for 2.5 cm to reach to the sternal end of the right third costal cartilage. Sternal end of right third costal cartilage. Then left principal bronchi, this is left principal bronchi, runs from lower end of trachea, here is lower end of trachea, downward and to the left for 5 cm. Its length is 2.5 and this length is 5 cm. To reach the left third costal cartilage 4 cm from the midline here, up to the left third costal cartilage and 4 cm from the midline. Okay, so this is how you draw the right and left principal bronchus. Next we go to the aorta. Aorta is very important. Mainly the arch of aorta very frequently comes in your surface marking card. Aorta in the thoracic region, aorta is divided into 3 parts: ascending aorta, arch of aorta, descending thoracic aorta. Ascending aorta is marked by 2 parallel lines 2.5 cm apart, and lines extend from medial end of left third intercostal space, here is the medial end of left third intercostal space, up to points at the right end of sternal angle here. up to the point right end of sternal angle. And you can remember from the mediastinum class, the arch of aorta begins at the manubriosternal joint. That is, it begins at T4 level, lower border of T4, and also ends at the lower border of T4. Okay, so it begins on the right side and ends on the left side. Okay. So arch of aorta, very important, marked by two lines 2.5 centimeter apart with outer convexity by joining these following points, point A, B and C, B, C and D. Okay. So this is point B, this is C and this is D. Point at the right end of the sternal angle, C is point at the center of the manubrium sterni and D is point at the left sternal end of left second costal cartilage here. So these 3 points you join by two convex lines 2.5 centimeter apart to draw the arch of aorta. Okay, understood? Next is descending thoracic aorta. Here is the descending thoracic aorta. From ending of arch of aorta, run downward and medially marked by two lines 2.5 centimeter apart by joining these following points. D is point at the left sternal end of the left second costal cartilage, that is the end of arch of aorta, and point E is point in the midline 2 centimeter above the transpyloric plane. Okay, this is transpyloric plane 2 centimeter above the transpyloric plane. Okay, here it enters through the diaphragm into the abdominal cavity and continues at the abdominal aorta. Okay, descending thoracic aorta after passing through the aortic opening continues downward as a descending thoracic aorta. Okay, from this point. And transpyloric plane, how you draw? From below the xiphisternum, you place the patient's hand. One hand's breadth below lies the transpyloric plane. Transpyloric means it passes through the pyloric end of the stomach. Okay, that's why the name given, transpyloric plane. Okay, understood? Next is internal thoracic artery. It sometimes come in your surface marking. Very important for coronary artery bypass graft. This is important clinical aspect. Internal thoracic artery is used for coronary artery bypass graft. It is marked by joining these points A, B and C. A, B and C. Point A is point 1 centimeter above the sternal end of the clavicle, 3.5 centimeter from the median plane. Here 3.5 centimeter from the median plane, 1 centimeter above the sternal end of clavicle. Point B is located here, point on the 6th costal cartilage. This is 6th costal cartilage, 1.25 centimeter from the sternum. Point on 6th costal cartilage, 1.25 centimeter from sternum. Next is point C. Point C is point in the 6th intercostal space. Below this 6th costal cartilage is the 6th space, 6th intercostal space, 1.25 centimeter lateral to the sternum. Here the artery, this internal thoracic artery divides into its two branches, musculophrenic and superior epigastric artery. Okay, this is musculophrenic and this is superior epigastric artery. So these 3 points, if you join with two lines, and you will use pink chalk dust because it is artery. For arch of aorta, ascending aorta, descending aorta, also you use pink chalk dust. Okay. So this is internal thoracic artery. Next is superior vena cava. For vena cava, you use blue chalk dust. Okay, and double line. So superior vena cava is marked by two parallel lines. This is superior vena cava, 2 centimeter apart by joining these following points. Point B, here is point B, point at lower border of right first costal cartilage close to the sternum. And point A, here is point A, points at upper border of right third costal cartilage. This is third costal cartilage, just at the upper border of right third costal cartilage. So these 2 points you join 2 centimeter apart by blue chalk dust. Next is right brachiocephalic vein. This is right brachiocephalic vein. These two brachiocephalic vein is joined to form the superior vena cava. So right brachiocephalic vein is marked by two parallel lines 1.5 centimeter apart by joining these following points. Point C and point B. C is point at medial end of right clavicle. Point B is point at lower border of right first costal cartilage close to the sternum here. Next, left brachiocephalic vein, point D and point B you have to join. D is marked by two parallel lines 1.5 centimeter apart by joining these following points. D is point at the medial end of left clavicle, okay, medial end of left clavicle, and here is point B, point at lower border of right costal cartilage close to the sternum. Next is esophagus. This is esophagus, point A, B, C and D. At all these points you have to draw 2 points at 2 centimeter apart, and you join these points with lines. Here you use white chalk dust. Esophagus, okay. So for all those veins, superior vena cava, right and left brachiocephalic vein, you use blue chalk dust, okay. These are veins. So esophagus marked by two parallel lines 2.5 centimeter apart by joining these following points. Point A is point at the lower border of cricoid cartilage. Here is thyroid, cricoid. So lower border of cricoid cartilage. Point B is point at the root of the neck, little deviated to the left. Here, this is point B. Then C is point at the sternal angle. This is point at the sternal angle. And point D is point at the left 7th costal cartilage 2.5 centimeter from the median plane. Here, left 7th costal cartilage, this is 6th, this is 7th. Left 7th costal cartilage and 2.5 centimeter from the median plane. So you join all these 4 points by 2 lines 2 centimeter apart to draw the esophagus. Okay. So these cards are very important. Arch of aorta, you practice these 3 points, ending, beginning and ending at same level, lower border of T4 or manubriosternal joint or sternal angle, and another point is mid of the manubrium sternum and anterior border of the left lung. The cardiac notch is present here, okay. So you practice these two very carefully. These are present in our department. These cards are very important, and those cards can be given, okay, which we have told you as important lines like trachea, superior vena cava or pleural reflections, heart borders. These are important surface marking. Okay, understood? Okay, that's all. Any queries from surface marking? You have seen the surface marking during superior and superior extremity in the cadaver. How you have to draw the point and lines. You have seen the surface how you have to draw? Okay, so like that you have to draw. Here we have discussed the theory portion, which points you have to take and all. You practice over the cadaver or on each other you can draw with chalk dust like this. You practice like this. Because in practical exam you have to draw over cadaver or some human representative, okay. হ্যাঁ ছোট করে যেটা, this one is location of the valve, okay. This generally does not given, generally the auscultatory areas are given, okay. Pulmonary area, aortic area, mitral area, the round যেগুলো গোল গোল করা ছিল ওগুলো হচ্ছে auscultatory area, ওখানে হ্যাঁ ওখানে স্টেথোস্কোপ লাগাতে হবে, ওকে। ও auscultatory area means ওখানে ওই হার্ট ভালভের সাউন্ডটা তুই শুনতে পাবি, শোনা যাবে। হ্যাঁ ওটা মেইন জায়গা যেখানে ওই ছোট ছোট লাইন ভাবে আঁকা ছিল, বুঝা গেছে? ওকে। আর মোস্ট ইম্পর্টেন্ট অ্যাপেক্স বিট তোকে প্যালপেটও করতে হবে ফিজিওলজিতে, and also you have to draw in surface marking also. Okay, understood?